Natalie Hartenbaum, President and Chief Medical Officer of Ocumedics, an occupational medical consulting firm. Dr. Hartenbaum is board certified in occupational medicine and internal medicine. She specializes in transportation medical issues and is a past president of the American College of Occupational and Environmental Medicine. Doctor, thank you for joining us this morning. First off, in this time of emergency, can you tell us what's the status of the commercial driving medical examinations and with regard to the expiration dates?
Okay, well, I know a lot of drivers and examiners, as well as carriers, were really concerned about those drivers who have their medical certifications expiring during this crisis. FMCSA has numerous emergency declarations, and one came out just, 2 days ago, that waived some of the requirements for a commercial driver's license as well as the commercial driver medical certification examination. What is happening is that the FMCSA has granted a waiver to the states on compliance of enforcing the medical certificate expiration dates. So what that means is that if you have a medical certificate that expires prior to June 30th, which is the duration of that declaration, that notice, the states will not enforce if that medical certificate is expired under certain circumstances. The states have the ability to not downgrade your CDL if the medical certificate is expired during that period in certain circumstances. And if you are stopped in carrying a medical certificate that has expired during that specific time frame, you will not be cited for having an expired medical certificate. So it's really a waiver of enforcement if the medical certificate has expired during this time.
Doctor, that waiver, does it apply to all drivers?
Absolutely not. First of all, it is not an extension of the medical certification. So if your medical certification expires, it's not as if you have an extra 3 months on that time. It's really an enforcement issue. If you have a valid medical certificate as of February 29th, 2020, and it expires after March 1st, 2020, then it would be applicable to you in most cases, but not all. Number one, you must have a certificate that's valid for at least 30 days. At least 90 days. So if your certificate is a 30-day certificate, you would not be covered. If you do not have a medical certificate, if you're a new driver, or if your certificate has expired prior to February 29th, then this would not be applicable to you. This would also not be applicable if you have a medical condition that develops during this time period, which would make you potentially disqualified. And in that case, you would need to get a medical examination. Many examiners are open, many examiners are running, and depending on who they are, where they are, you may be able to get an exam quicker without waiting if you're not involved in direct support of COVID-19.
Doctor, going to another area of occupational medicine with regard to the transportation drug testing. Where do we stand with that, doctor?
Again, lots of concerns, lots of changes, concerns over breath alcohol testing in the equipment, which is really felt to be pretty safe. But granted, people have concerns about blowing into something that someone else may have blown into, even though it's going to be a fresh tube. There's also some difficulty in some of the collection sites. And some of the other service agents may or may not be available, whether they're otherwise supporting the COVID-19 issues or just limiting their access to other individuals. So what the Department of Transportation, ODAPSI, has done is they've really reminded everybody, drug testing is still in effect. You still need to make every reasonable attempt to get drug testing done when it's necessary. There are certain types of drug testing, such as random or follow-up, that can be scheduled. They can be scheduled later in the testing period. So employers should certainly do that if at all possible. The important thing is don't notify the drivers that they've been selected, but then not send them for the month or the rest of the quarter. So that's important to remember. Secondly, if the driver, for very valid reasons, may feel that they don't feel comfortable walking into a healthcare facility, they don't feel comfortable blowing into a breath machine, carriers should treat this like any other evaluation of why did the driver not test in evaluating, is this a true refusal or not? Is there a valid reason? There's no test sites within 100 miles. This is a post-accident, and there's no way possible to get a post-accident test within the required time, whether it's the 32 or the 8, because there's just no availability, and we've made that attempt. In that case, you document it just like any other unable to collect, unable to test. And it's up to the employer to determine whether or not the driver has a valid explanation as to why that test was not able to be done. Just like the medical exam, this doesn't apply to every single drug test. If a driver is a new driver, they must have a negative drug test prior to providing services. If the driver is out because of a violation of the drug testing regulations, they must have a return to duty drug test. So it is not just a blanket, you can ignore it if you can't easily get the test. There are some situations where you can document why it's not possible to get that, although whenever possible, make attempts to make alternate arrangements using mobile test sites. Mobile test sites. That was a mouthful this morning. I haven't finished my coffee. Or if it's a scheduled test, schedule it later in the month. But there are still very many that are still required.
Doctor, there's some exemptions on hours of service for certain instances. From an occupational medicine perspective, your thoughts in terms of that as it relates to the drivers and our transportation system?
Well, first of all, while you are exempt from the hours of service requirements, the ELDs, the rest, the 60-70 rule, the 34 hours, all those, if you're providing direct support of the COVID-19 issue, that does not mean that you can drive forever and ever and ever and do it safely. So you need to some extent understand that fatigue is still going to be an issue. You have you should be telling your carrier employer if you feel unsafe to drive. You are certainly required to have that 10 hours off duty if you're transporting passenger materials, 8 hours after you finish the transport in support of COVID-19. But you still need your rest. And, all I can say is, yes, understand that there's some leeway there, but it doesn't mean to just keep on driving until you collapse. That's not going to help anyone. And while you're trying to help the economy, you're trying to help our infrastructure. If you can't drive, it's not going to be helping anyone.
Well, one last thing, Doctor, while I have an expert in occupational medicine here with me today, any thoughts in terms of how the drivers can keep safe out there in the word of the epidemic?
Yeah, I mean, it's a lot of the common sense that you're hearing over and over again. Wash your hands with soap and water, especially if you're touching lots of different objects. Alcohol-based sanitizers are great as a second choice. When you can, stay away from crowds. The roads are pretty empty nowadays. I know that a lot of the truck stops have reopened, not all of them. Try to spread around. I know it's nice to have that relationship, be able to talk to other drivers, but it really is very important to try to keep that at least 6 feet distance. Certainly if you see somebody that's sick, try to avoid them. And keep yourself healthy. Try to eat right. Try to get the rest that you need. If you do become ill, contact your health provider. There are a lot of telemedicine resources available, and I know a number of trucking organizations are posting this on their websites. If you need medical attention, if you can get back home, great. If you're too ill to get back home, there are resources, again, where you may be located.
Doctor, I'm sure you're joining me as I do at the end of these in thanking the folks in the supply chain system, particularly the drivers who are out there providing us and keeping us fed, as well as bringing the medical supplies we need to fight this pandemic.
Absolutely.
Truly are the lifeblood of America. Doctor, thank you very much and appreciate your time. Take care. Have a great day. Stay safe.
Thank you, you too. Bye.